Your Dog's Friend is a nonprofit 501c3 whose mission is to help keep dogs out of shelters by educating and supporting their humans. We promote positive method of training and behavior modification through stress-free methods. As part of that mission, we offer free webinars like the one you're about to watch. Subjects range from dog behavior, stress-free training, and other tools to help you understand your relationship with your dog. If you like the webinar, be sure to give us a thumbs up. Click the notification bell and subscribe to our channel. By subscribing, you'll be notified when future videos are posted. Now enjoy the webinar.
Welcome to your Dog's Friend webinar series. A lot of you are returning, so welcome back. Today's webinar will help you understand and use desensitization and counterconditioning, two techniques that together treat many behavior issues. Before we start, though, let me introduce you to our speaker, Dr. Amanda Rigterink. Dr. Rigterink is a board-certified veterinary behaviorist, one of only 87, I understand, in the US, Canada, and Australia. She works at Veterinary Behavior of Indiana, and she is a fear-free certified professional, as well as an active member of the American Veterinary Medical Association, the Indiana Veterinary Behavior Medical Association, and the American Veterinary Society of Animal Behavior. Please put your questions in chat. We will get to as many as possible at the end. And the other thing I should mention, although I kind of hate doing it, is that we rely on donations to keep our free services, including these webinars, going. So if you are so inclined, we have a donations icon on the homepage of our website, and you can go there anytime and click on it and give us a donation. You obviously don't have to, but we really appreciate when you do. I know that we will learn a lot today. I need to know as much as you do about these techniques. So let's welcome Dr. Rigterink, and it's all yours.
Thank you, Deborah. I'm very excited to be speaking to everybody across the world. I guess now that's really exciting. Thank you for everybody to join us this afternoon here in Indiana. Springtime is here in Indiana. I don't know what it is like across the world, but thank you very much. So today we're going to be talking about desensitization and counterconditioning, basically these training methods and how to treat behavior problems. So the outline of today's presentation, we're going to look at behavior development in dogs, and then really kind of understand how dogs learn, and then really focus on what is desensitization and counterconditioning, and how do we use desensitization and counterconditioning to work with dogs. So it's really important to know that there's been a paradigm shift. The emotional well-being of all dogs is very important to contribute to their overall health and well-being. Thanks to the fantastic work of Dr. Sophia Yin and her creation of the low stress handling certification, and also fear-free. It's very, prevalent that we really look at the emotional well-being of all of our dogs. So just quickly, I know Deborah gave a little bit of an introduction of what a veterinary behaviorist does, but I am a veterinarian, and I was in general practice for a few years before I went back to do my residency in veterinary behavior. Veterinary behaviorists not only look at the animal's health and well-being, but we also look at what's going on inside the brain. We, definitely have to have a good understanding of learning theory, which we'll talk about, and how dogs learn. So I thought this was a cute cartoon because, basically, if I try to describe what a veterinary behaviorist does to my friends and family, they say, "Hey, are you a psychiatrist?" It's very important to know that behavior is occurring all the time. So, no matter, we can't stop behavior. We always want to know, animals or dogs in particular, we see it in many different situations. Dogs are always learning. So the most important thing to know that there's definitely three main factors that influence the development of behavior. The first one is genetics. The second one is environmental influences. And also the third one is learning. So with the behavioral developmental periods in dogs, definitely the fetal period is very important to even before a dog is born. And then also, the different neonatal period up to 10 days. We see that transitional period of development between 11 and 21 days, the socialization period, and the juvenile period. So the socialization period in dogs is the most important period of development. It's usually between 3 to 12 weeks. This is the period of development that's closely associated with the maturation and the myelination of the brain and the spinal cord. It's all when the sensory systems are functional and learning capacity increases. There's also a very rapid development of social behavior patterns during the socialization period. So during the socialization period, we definitely want to try to expose the puppy to all things and situations that it's encountered during their everyday life. But we don't want to do it or set it up in situations that causes excessive fear, withdrawal, or avoidance behavior. It's very important to know that there is a position statement on puppy socialization through the American Veterinary Society of Animal Behavior. You can go online and download the position statement. And I think the two main points of the position statement is that puppies can start socialization classes as early as 7 to 8 weeks of age after receiving their first set of vaccines and deworming. And that early and adequate socialization and positive training programs are very, very valuable. So I know that my parents actually took their puppy to a Dog's Friend puppy socialization class, the kindergarten, and now he's on to first grade. Basically, not only are the dogs learning particular socialization and also human interaction, but they're also learning about, desensitization and counterconditioning, which we'll talk about a little bit later, to handling and also using certain nail trimmers or brushes in a positive manner. So the juvenile period is when the 3 months to puberty. So definitely we call this the teenage years. Basically, it's when basic learning appears to be fully developed. Social maturity starts around 18 months of age, and then the dogs are fully mature about 2 to 3 years of age. So when we adopt a dog with an unknown or limited socialization, you have to remember that adult dogs vary in temperament, their past experiences, or what they've actually been adapted to. So we kind of need to go very slow and gradual to new environments. This little puggy is my pug, Roxy, who was adopted from a commercial breeding operation at 4 years of age. Now, we gradually introduced her to things, but it wasn't like that I would take her to many different places or have many different experiences. We had to go very, very slow with her socialization. So now we'll jump to talk about a little bit about a dog's brain and the influence of behavior. So, back to anatomy class, there's three main areas of the brain. There's the cerebrum, the cerebellum, and the brainstem. The cerebrum is the main part of the brain that we really look for problem solving and logical thought. Within the cerebrum, there is the limbic system, which is the emotional center of the brain. And the amygdala in specific is responsible for detecting fear. So this is just a cross-section of a dog's brain, and you can see that the limbic system is highlighted here in the different parts of the brain, of the cerebrum. But the amygdala is what we really focus on because it's the most active in immediate fear situations. Really, it's what becomes overactive, or it's really the startle circuit of the brain. And really knowing that panic increases the amygdala activity, which also leads to prolonged fear, regardless if there's an actual threat that's present. And that's where we kind of see that panic response. So moving on quickly to fear and anxiety. So definitely fear is that innate emotional response to a stimulus or a trigger that's perceived to the dog as threatening. It really involves a lot of different responses, physiologic responses like increased heart rate, increased respiratory rate, neurochemical changes, and then overt behavioral responses or body language changes. So the fear response in dogs, so basically, if that type of signaling, if a dog is giving that signal to diffuse or appease a perceived threat, if the dog is continuing to put pressure and it's showing signs of fear, it will go up that aggression ladder, and this is where we will see aggressive behavior. So it's really important to understand, especially for when we start to work with dogs on desensitization and counterconditioning, what are signs of a fearful dog? A lot of people can recognize when a dog is about to snap, lunge, bite, but there are very subtle signs of fear that are missed by the average owner. So subtle signs of fear can include anything from scanning the room or being very hypervigilant to what's going on around them. Also panting when it's not hot. So you see a lot of panting, or you can see a lot of yawning, lip licking, all of a sudden refusing to take treats, or salivating in the absence of food, maybe looking sleepy or distracted, or sniffing, salivating, urinating, and or defecating. So I always use this picture courtesy of a little girl sticking their face into a dog. And if you kind of can look at this dog's body language, you might start to pick up on very subtle signs of fear. So signs that you can see here is that wide-eyed stare, the ears are pulled back, the brow is very furrowed, there's a tense, tightly closed jaw, and also the body posture, and I know this is just a snapshot, a very stiffened posture there. So it's important to know that the fear response on learned behavior. So remembering that fear is not under a dog's cognitive control. Basically, that the inducing situation, the fear-inducing stimuli or trigger, it creates a vivid memory, like a snapshot in time. And then these memories are easily retrieved when the dog is put into that situation again. So it's important also to remember that a fearful response can be triggered by a visual stimulus, such as seeing a dog across the parking lot or coming the other way down the street, or a human walking along. Also, of course, it can be triggered by an auditory stimulus, such as fireworks or thunderstorms, or hearing the doorbell ring, or the Amazon package being delivered in the front porch, or knocking on the door. Also, it's also important to remember it can be triggered by an olfactory stimulus, such as, definitely if dogs can smell another dog on the other side of the door, or can smell a dog walking down the street without hearing any auditory or seeing any visual stimulus. So anxiety is also good to refresh on the definition of anxiety. So it's definitely the anticipation of the danger or threat. The anxiety, the dog is more vigilant, the dog is prepared to respond to the threat, and the most common visible behaviors that humans can pick up on include elimination, so house soiling, urination or defecation, destruction, and excessive vocalization. A lot of patients that have anxiety will be pacing a lot, panting. There's definitely very subtle signs of anxiety that, unfortunately can get missed sometimes too. So we'll move on to learning, and it's important to know that learning is a process which an event produces a lasting change in behavior. And remember, like I said before, that learning is always occurring. You can't turn on and you can't turn off learning. You want to engage the internal processes of perceiving that event, then you categorize it, the experience, and then that creates the memory. So it's important to know for dogs, for optimal learning to occur, that the dog must be in good health and well-being, that there must be in a very calm environment without too many distractions, and also that the dog must be in a comfortable emotional state. So for optimal learning, you really need to set up the environment for the dog to be able to learn. And that's an important consideration to remember. So the roadmap of learning in dogs, so we have two main types of learning. We have the non-associative learning, and we'll go over these in more detail. That includes habituation, sensitization, which includes flooding, and then also desensitization. And then we also have the second category of learning called associative learning, where we see classical conditioning and also operant conditioning, which is more of a trial and error learning. So if we look at non-associative learning, the two main types is habituation, where we see a decrease in responses after repeated exposure to a known stimulus, versus sensitization, which we see an increase in responses to a known stimulus after repeated exposures. Remembering that both habituation and sensitization occur repeated exposures. It's not a one-time event. So if we look at a young puppy who has never had a collar on before, and then you put a collar on, and then you put a leash on, that puppy, hopefully, over time, becomes habituated to wearing a collar and a leash. The other example, or versus sensitization, right? So a dog might hear thunder, and it might, be alert or unsure of what the thunder is, but every time it starts to hear thunder, the response becomes stronger, the fear response becomes stronger, and then that causes sensitization. So it's important to note that flooding is when there's continuous exposure of the dog to a stimulus. And that, basically the level of the response evokes a strong response, and until the response to that stimulus decreases. So, for example, I'm using the show Fear Factor. If you remember that show, I guess it's been on a while back on TV, where they, would put some poor soul in a vat with a lot of snakes. So to me, this is considered flooding, that the person is not responding, but basically the stimulus is continuous and they stop responding because there's so many snakes around her. So it's important to note that desensitization, we consider it non-associative learning, right? So desensitization really means to gradually expose the dog to the stimulus at a low level so that's not to evoke an undesirable response. A very classic example in dogs for desensitization includes using the fireworks CD and playing the fireworks CD at a very low volume in order to not evoke a response of fear, anxiety, hypervigilance, concern to that sound of the fireworks. There's many different fireworks CDs out there. If you want to start to work on desensitization. So the process of desensitization is that you really have to find a good starting point. You want to expose the dog to the thing that is afraid of at a distance or a very low intensity where the dog is not fearful. And you definitely want to make sure that when the dog is completely comfortable at that distance intensity, you want to gradually decrease the distance from the stimulus, but you don't want to go too fast. You want to stop each time and waiting till that dog is comfortable. So I thought it would be easier to kind of show some examples. And I think what's most important about creating a systemic desensitization plan is that you really have to start to look at the characteristics of the particular stimulus or the particular trigger that influences the dog's response. So you have to, then you want to really prioritize what characteristics are we going to start with and determine the non-stressful starting point, and then also create very structured practice situations. So I wanted to first use a human example, and then we'll move on to dog examples. So to set up a systemic desensitization plan, let's say that I am very fearful of snakes, and I wanted to systematically desensitize me to the fear of snakes. So I might start with a picture of a snake. And with that picture of the snake, if I, look at it and, okay, it's not too bad, and really concentrate on it, maybe the next step would be to hold a toy snake, right? So again, a toy snake is, look at it, kind of adjust, and okay, maybe that's not so bad. Maybe, I can hold a glass container with a snake inside. That might take me a little while more. Might have to do multiple sessions where I'm holding the glass container or looking at the glass container with the snake inside. And once I feel comfortable with that, maybe start holding a small, harmless snake, and then maybe going on to holding a regular size snake. So really, when we look at systemic desensitization with working with your dog, we really want to look at, how close is this trigger or the stimulus to the dog, right? In this particular example, this dog is fearful of other dogs on walks, per se. We know that that distance is way too close to the brown dog, and also the second, distance is showing the dog showing that low level of fear signs that we talked before about. And then if we increase the distance, okay, this is a very relaxed, maybe, or alert signals going on, and we want to repeat exposure at this level. So I thought it would be good. This is a training session with one of my trainers that I work with, Connie Swain. She is using a decoy dog to help this dog set up a desensitization and counter-conditioning protocol. So at this distance from the decoy dog, the dog is alert and watching the dog. And, at this, they moved a little bit closer, the dog was over threshold, so they repeated the exposure at this distance. And then they would give the dog high-value bite-sized treats at this distance before moving closer to the decoy dog. So I think it's, also good to know that counter-conditioning is often paired with systematic desensitization. Counter-conditioning is when we are changing the dog's emotional response, their feelings, their attitudes towards a stimulus or a trigger. I think my favorite example of counter-conditioning, maybe because I love Starbucks, is when your dog goes to Starbucks, or if you allow that, to get a pup cup. I think it can be very overwhelming for somebody to reach into a car and give you a coffee, but if the dog is anticipating that they might be getting a pup cup, this is kind of considered counter-conditioning. It's changing the dog's emotional response towards the stimulus and or trigger of a person reaching into the car. Like I said before, we usually pair systematic desensitization and counter-conditioning together. It can be abbreviated DSCC or counter-conditioning desensitization, CCDS. And we remember to use that combination of the two techniques, the systematic desensitization and the counter-conditioning, because we want the dog to learn a new emotional response through associations while we habituate to that stimulus or that trigger. So I think it's, I thought a good example is that we really want to think of this as the emotional response or an emotional reaction. So when we want to change your dog's emotional reaction to something that it fears, so in their mind, they might say, danger, danger, to something that, okay, they see it and say, oh boy, oh boy. So I get treats every time I see the basket muzzle, the nail trimmer, the man with the scary sunglasses and the hat. You can use a lot of systemic desensitization and counter-conditioning to multiple scenarios. So, options are endless in terms of what possibility you can work on changing your dog's emotional response using desensitization and counter-conditioning. So examples can include, like this picture shows here, trimming your dog's nails in a systematic desensitization and counter-conditioning way. As we also talked about before, approaching and passing dogs on walks, using it for a fear of a certain noise, whether it be a noise inside the house, like the ice maker machine dispensing ice, versus a noise outside the house, like thunder or fireworks, or a visitor coming into the house. So again, this is just a few examples because the possibilities are really endless in terms of what you could use this for. So it's always important to remember that you want, again, to start with the stimulus intensity that's least likely to cause an adverse response. And this can be very different for every single dog. And, you know, there's no set plan. You have to kind of see what parameters you're trying to aim for, and what, you know, in terms of the dog's response, and what is the intensity that we need to start with. And really, like we said, for optimal learning to happen, we want to pick the environment that's least likely to cause fear or anxiety. And we really want to make sure that we control the presentation of that stimulus or trigger and its intensity. And we really want to make sure that we use high value reinforcers for training. So high value reinforcers can be anything from treats for one dog, to a ball to the other dog, to a tug rope. It really depends on what is the most reinforcing for that particular dog. So I think it's really important to remember that this is a Susan Clothier article on understanding thresholds in dogs. And these 3 questions are really important to know to how to set up the desensitization and counterconditioning plan. How intense is that trigger for the dog? Like I said, do we know, is it the way the trigger is moving or just the appearance of the trigger? How, you know, what is the intensity and what is the distance that the dog can, you know, be aware of the trigger, but be able to disengage from the trigger. And then also how long, right, will the dog be asked to deal with a particular trigger? So it's very, very important that we want to keep it brief. We want to listen to what the dog is telling you, and not make sure that the trigger is not too long or too drawn out, because that is not going to be helpful with a systematic desensitization and counterconditioning plan. So the reinforcer, again, depends on the particular dog. You know, some dogs do like carrots, and think of that as a high reinforcer. But, you know, honestly, a lot of dogs like stinky meat, and, you know, something that's very desirable to them that they get no other time. And so we definitely have that scale of reinforcers that we want to be aware of, because every dog is very different. And knowing that the sweet spot for desensitization and counterconditioning, so that sweet spot is just when your dog is at threshold in relationship to the trigger. And that threshold is when your dog notices the trigger and displays mild concern, but is able to disengage and is able to move on. Granted, you know, it's not something, you know, it can be a little bit of, you know, trying to identify and what exactly is the threshold, and really in desensitization counterconditioning, we want to move slow. We don't want to proceed too fast. And we don't want to go over threshold, you know, too many times with the desensitization and counterconditioning plan. So this is Eileen Anderson's graphic here. If you see the dog there, that the threshold of the stimulus perception is the starting point. And if we look at that green line there, that's where we want to work on before the threshold that the stimulus becomes aversive. So we want to really kind of modify our desensitization and counterconditioning plan in that green zone. We, definitely want to avoid the blue line or flooding per se, because that is not desensitization and counterconditioning. Gene Donaldson has created what's called an open bar, closed bar training game that basically is a systematic desensitization and counterconditioning. And I like her analogy that the bar means feeding high-value treats. So that moment when the scary stimulus appears, the bar opens, and the feeding of the high-value treats is at a high rate of reinforcement. The moment that that scary stimulus disappears, the bar is closed. And only that scary stimulus and nothing else makes the bar open. And the bar open is regardless of what the dog is doing. So if the dog is, basically looking at it, barking at it, the treats are coming, and then if the stimulus is removed or the bar is closed, the treats stop. So this is an example from a trainer that works with me. Her name is Kristen Board, and she is working on open bar, closed bar with this dog to the sound of the vacuum cleaner. I'm going to mute this. So basically, you can see that the dog is coming near the vacuum. She turns it on. She's feeding treats at a rapid rate, per se. The dog is wondering where the treats are coming from. The treats are falling from the sky. The vacuum is turned off. And the dog is looking what's going on, sniffing the ground, kind of unsure of why the treats were coming there, walking away. And then the dog comes back. And then she should be turning on the vacuum, and the treats start coming again. She reaches in her pocket and pulls down the treats and puts it on the floor there. And then the vacuum's off, the treats stop, and that's the end of the session there. So it's important to remember that desensitization is not just about exposure. We really want to monitor the dog's body language for signs of fear, for signs of anxiety, and signs of stress. And remember that it's always important to recognize your dog's body language before, during, and after your dog reaches their threshold for a particular stimulus or trigger. We want to know what the dog's relaxed body language is or the dog's neutral body language is. We want to know what its, basically body language is when you reach that threshold, and then also after. And we really want to stay with the dog's neutral, relaxed body language during desensitization. So this is definitely a diagram here that kind of shows when a dog encounters a trigger. And this is basically that we want to stay in the green zone on the bottom, which is very loose body posture, soft mouth and ears, able to respond to the handler, able to self-soothe. And when we are reaching the threshold, the dog might be able to show attention towards the trigger, that they're watching, the mouth is closed, they're focusing their eyes, maybe they're slowing down. And if we know that they go over trigger, that they're staring, the tense body, the ears might be back, they're not responding to you, and are also, if we're using counter conditioning, not interested in food. And then, of course, if we keep going up that stress level, then we start to see that barking, growling, snapping, and lunging. And then these reactive behaviors are a display of frustration, fear, or anger. So this is another example of desensitization and counter conditioning. But this example is using a brush and rewarding the dog for noticing the brush but staying under threshold. So we want to start very small, calm, relaxed response, that the brush is coming out and that the treats are coming out. And if you can see that the stimulus or the trigger is presented first, and then the counter conditioning. So now Amy McPhail is touching the dog with a brush to a part of the body. And, basically the treats, are coming right after she puts the brush onto the dog there. You can see that the dog is starting to lip lick a little bit, ears are back. A little bit of yawning, and we know that this dog might be showing some mildly uncomfortable behavior. So she decides to go back to less contact until he's relaxed with that. And, possibility, this session might have, I'm not sure if this was the first few sessions or if this was session 20 through 30. But, it's always important to say, okay, if things are getting a little bit uncomfortable for him, then we should maybe stop this. So we just want the overall goal, right, is for them to enjoy being brushed. And not just tolerating it. And you can see his ear position is very evident of how he feels. So she tosses the treat away when she's done with the brush there. So again, desensitization and counter conditioning can also be used when a dog is fearful of moving objects on leash like bicycles. So this particular picture is, from the internet, and we don't know exactly what the systematic desensitization and counter conditioning plan. I assume that the distance was increased, but the owner was waiting for a cyclist to go by, and the treats flow while the cyclist goes by, and the treats stop after the bike goes by, and slowly decreasing the distance closer to the trigger or the stimulus in this particular situation. There definitely can be mistakes with desensitization and counter conditioning. And these mistakes doesn't mean that you need to stop what you're doing, but it's a time to reevaluate and say, what am I doing wrong that this is not working for this particular dog? So I think one of the most common mistakes that we see with desensitization and counter conditioning include that the treats are not high enough in value or the reinforcer is not high enough in value. We want to bring the big guns out, whether that be pieces of chicken, pieces of steak, something the dog does not get in other situations when you're working on training. We want to, make it something that is really, really valuable to them. The other common mistake that we can see is incorrect timing. So it's important to know that we want to make sure that the trigger or the stimulus is presented before the counter conditioning or the reinforcer treats ball. And we also know that if we decrease the distance from the stimulus or we, push the dog further before they're ready, then it's too fast. we really want short training sessions and make sure that we end on a positive note rather than very long and drawn out training sessions. And, also we definitely see that owners will all of a sudden stop giving treats when their dog is over threshold. So if the dog is over threshold, you went past that threshold gradient, that doesn't mean that you don't stop giving treats. We will definitely have to adjust or, increase the distance, but, it's okay. You still, because it's straight counter conditioning, we want to make sure that we are still, giving the treats, even if we have to evaluate where our systemic desensitization plan is. All right, so definitely, like I said before, we can definitely see a lot of success with desensitization and counter conditioning. Our overall goal, right, is to create a positive conditioned emotional response for that particular dog. And we always want to work under threshold and make sure, like I said before, that the order of operations is right. So desensitization and counter conditioning, again, can be very successful, and it's not that hard to implement if you have all your parameters set. So, of course, Chirag Patel has this wonderful video about teaching a dog to wear a basket muzzle. You can definitely find it under his training videos in YouTube. And I took some screenshots of him working with this particular dog because I wanted to kind of show you that when he presents the basket muzzle, so the basket muzzle is in sight of the dog, the treats are at a high reinforcement rate. And when the basket muzzle goes away, the treats stop. Definitely this is one of the first, behavior patterns we want to see when we're introducing something that is perceived to the dog maybe as scary or unknown if they've never seen a basket muzzle before. What also Chirag does, which is great, is that a ball is very reinforcing for this dog too. So I know this is a screenshot, but he's about to throw a tennis ball for this dog after the basket muzzle is presented to the dog. So the basket muzzle is presented, then the ball is thrown to the dog. It's also important to remember that we, as veterinary behaviorists and also veterinarians, we want to promote happy visits to a veterinary hospital or a desensitization counter-conditioning plan to a veterinary hospital. Of course, with the times of veterinary hospitals being very busy and so forth, I think it's also important to remember that, the desensitization and counter-conditioning for a dog to a veterinary hospital doesn't have to begin with going into the veterinary hospital. We can also start with working with the dog, outside in the parking lot, letting the dog sniff the ground when the veterinary hospital is closed, feeding treats, and then, going home. So again, very short, successful sessions with a high value reinforcer using treats to form a positive association. This particular dog does have situational anxiety of going to a veterinary hospital. And this is the owner, basically, at a time when into my consult room that nobody else was there. And she was just working on some fun training games and fun enrichment with the dog, and again, just to form that positive association. It's important to also know that, dogs definitely learn that, coming into a place is not so scary if they can have these positive short experiences. Okay. So I'm just going to briefly talk about associative learning. So we talked about non-associative learning, and I want to make sure that there's a distinction between non-associative learning and associative learning. So associative learning is when a dog learns to associate two things that happen together or that they're closely together. And the two main categories of associative learning include classical conditioning and also operant conditioning, what is otherwise called as trial and error learning. So classical conditioning is when the animal associates a novel stimulus with another stimulus that already causes a reaction. And then after repeated pairings, the novel stimulus will also cause the reaction. We call this Pavlovian conditioning. And the biggest, example, of course, is ringing the bell. The dog has no response because it's a neutral signal, doesn't have any emotional meaning. But if the dog is presented with a bowl of canned food, the reflex is salvation, right? So unconditioned stimulus of the bowl of canned food. So if we pair the ring of the bell with the unconditioned stimulus, that causes that reflex or respondent behavior of hypersalivating. And then we, after multiple repetitions of the bell and the food causes this reflex or respondent behavior, then we work on the antecedent or trigger, in this case, the bell causing the conditioned response, knowing that the food bowl is coming when the dog hears the bell. So that was classical conditioning, and operant conditioning is a behavior that is affected by its consequences. So a dog associates performing a specific behavior with either some type of benefit or detriment, and then the behavior becomes more likely to be reinforced or less likely if it's punished. So here are the 4 quadrants of operant conditioning. So if you add something or something is given to a dog, that will increase the likelihood of the behavior being repeated, or that's called positive reinforcement. If you add something and, basically something to decrease the behavior, that's positive punishment. And then also we have negative reinforcement. So if something is taken away for the dog, and then that increases the likelihood of the behavior, and then also negative punishment if something is taken away, likely to decrease the behavior. So I have to use these examples or similar examples to help me kind of differentiate the 4 quadrants of operant conditioning. So basically, if we add something when the dog comes to the owner and gets treats, that's a positive reinforcement. If you're asking for a behavior, you're adding something. So if the dog sits, then the dog gets the treat. So positive reinforcement. Let's say a dog is barking and the collar squirts citronella and the barking stops. That is adding something to decrease the behavior of barking. Let's say that an owner turns around and stops giving attention to a dog, and the dog stops jumping. That's negative punishment. Or when an owner is holding a dog and asking them to sit, the pressure of the collar is released. That's called negative reinforcement. So again, these are all associative learning techniques under operant conditioning. And it's not to say that we do use operant conditioning sometimes intermixed with desensitization and counterconditioning. And it's really important to note that, operant conditioning and desensitization and counterconditioning can be used together, but I want to make sure that we understand that, desensitization and counterconditioning is more of an emotional response, while operant conditioning is asking a dog for a behavior and waiting for their response. So key points for today's lecture. So we need to know that behavior and learning are always occurring for humans, for dogs, for other animals. We can never just turn off learning. Every single moment is a learning category. Desensitization and counterconditioning is definitely the way to help a dog change their emotional response to something they find scary, unsure of, fearful, uncertain of. And for counterconditioning, we want to make sure that we use high-value reinforcers. So here is a list of some of the references I used in terms of textbooks. And, you know, definitely there's a lot of really good information out there. And I know that most of you will probably have a few questions, and I want to thank you for listening. I hope you guys could hear me okay and see me okay. We did have some technical difficulties. If you're able to reach me through my email, info@indianavetbehavior.com. But Deborah, if you want to open up the chat box and let me know if there's any questions.
Yeah,
thank you.
There are questions. I've been trying to take notes quickly. Okay. What if you don't know the information about your dog before your dog was a juvenile?
Yeah, that's a good question. I mean, definitely a lot of people don't know if the dog was adopted from a shelter or rescue or the dog was a stray. And I think it's always advisable to proceed slowly. I think there's a misconception about socialization that you need to expose your dog to a lot of different things. And that's not always the case, right? You want to make sure it's very gradual and systematic to be able to monitor your dog's body language and comfort level with new experiences and new environments.
Okay, and what about jaw chattering? Is that emotional or physiological?
Yeah, I would say, I mean, I think I would probably label it as emotional. Definitely jaw chattering can be a sign of arousal. And, you know, depending on what the antecedent arrangement is before the dog is jaw chattering. But, you know, in addition, of course, being a veterinary behaviorist, we want to make sure that we're ruling out any pain or discomfort that's causing the jaw chattering too.
Can you explain the difference between CC and OP again?
CC and, oh, I didn't hear the second one.
OP? Is there
OT?
OP?
Hopefully, I'm not sure what.
Write back again and explain what you mean by OP, and we will figure out what you're trying to ask. Okay?
Yeah. So CC, I can answer that one.
Yeah.
CC, counterconditioning.
Do you know where you can play CDs? I know Legacy Canine, a lot you can find on your phone, but someone was looking specifically for like delivery trucks.
In terms of desensitizing and counterconditioning to sound, you know, I think, yeah, definitely, you know, a lot of different apps now, and YouTube has plentiful things. I'm trying to think of one. I mean, I honestly, if I have a particular sound that I want to work on with a dog, I will sit there with the owner and kind of go through the sounds and find one that they think is, you know, without the dog right there present, that they think is very likely to cause the reaction or very similar to what the dog is experiencing. So I don't usually tend to go to one particular app. There's multiple ones now.
Okay, now Kim has a 4-year-old dog who's highly stimulated by toys, play, and treats. They're working on trying to keep him calmer. So what can she use for counter conditioning?
Yeah, I think definitely it's a good question, because I think, it really depends on the environment that you're working on training. So let's say you're working inside the house, and, maybe, or you want to set up your desensitization and counter conditioning plan, you can use lower value reinforcers, something like their dog kibble or Cheerios, to see if that causes that same hyper arousal response, or not. But really, it really depends on trying to find that particular reinforcer in a low, a low distraction environment before you start to work on it in a desensitization and counter conditioning plan.
Okay, and Carol got back to us. She is trying to figure out the difference between classical and operant conditioning.
Okay. I kind of breezed through that, so I'm glad that you asked. So definitely, classical conditioning and operant conditioning are two forms of associative learning. So the dog learns to associate two things that happen together or very closely related or closely together. And so classical conditioning is usually when there is a novel stimulus with another stimulus that causes a reaction. So I guess another example would be that, if your dog knows that the sound of a treat bag means that they're going to get a treat, or the cat or cats know that the sound of the cat food opening means that they're going to get fed. So basically the sound causes that reaction per se. And more operant conditioning is, definitely when the dog performs a specific behavior, and that behavior is likely going to be increased or decreased in terms of, so it's really affected by its consequences. And that's a kind of a definition of operant conditioning. It is, it can be confusing for sure. And it's always, I think with learning theory, it's really good to delve in there and read multiple resources for these type of learning theory in dogs.
Okay. Does open bar, closed bar work when the dog is above threshold?
Good question. I think for sure that if we know that dog is over threshold, I would not stop offering the treats, but we know that that dog is over threshold, so we have to increase the distance, or, stop the session and say, okay, we need to go back a step before we, repeat the open bar, closed bar. So, for example, most likely it would be good, my vacuum example, if the dog was very fearful of the sound, a starting point might have been for the dog to be 3 rooms away rather than so close to the vacuum in that particular session. So we really want to make sure that we use distance or intensity to help change the emotional response.
Next question. What about if you can't keep your dog far enough away, such as passing a dog on a trail?
Good question. I think trails are very narrow. So, in Indiana, we have a wonderful Monon trail that's very narrow. So I probably would not set up my systematic desensitization and counter conditioning plan there. I might go to a open park and really be as much as possible far enough distance away from a walking path that we can see a dog in the distance, and maybe even use visual blocks if needed, and really try to avoid, situations where we are putting the dog over threshold by the distance is way too narrow.
So basically, walking on a trail may not be the best idea.
Yeah, I mean, we definitely want, if we are working with systematic desensitization and counterconditioning, we want to try to avoid, basically going over threshold, or we want to try to avoid the known triggers as much as possible. And, for example, if this is a leash reactive dog, we want to try to find quiet areas to walk. So we always, try to recommend things like office parks on weekends, or, if local cemeteries allow dogs to walk, very quiet areas where you can increase the distance. And I know that's not very possible if you live in an urban environment, but we try to be creative, maybe go on off hours or times when we can't see, or if the trail you're able to increase the distance, but it can be tricky in narrow areas.
Okay. A few people said things like this. Their dog would just grab the treat and go back to fixating on whatever they were fixating on.
Right. So if the dog is grabbing the treat, then most likely their emotional arousal is pretty high, I would say. So we really want to look for more relaxed, able to take the treat, not so hypervigilant to what's going on. So maybe, and again, there can be multiple factors. It's really hard unless, I definitely, think that working with a certified trainer that uses positive reinforcement, non-aversive methods of training is very important when you start to work on a systematic desensitization and counterconditioning plan. So they can help you with the training plan and making sure that, what are we missing when we're working with this dog in terms of what we're trying to accomplish with the systematic desensitization and counterconditioning plan.
Okay. Someone else wanted to ask you more about positive punishment because she had never heard that term before.
Okay. Yep. So positive punishment is when we add something to decrease behavior. So we can add something like a squirt bottle, spraying the dog with water to decrease the behavior of barking. Of course, positive punishment includes a lot of the aversive techniques, using a shock collar to stop the dog from lunging. I don't know if that helps or not.
You can write back to us if you need more information. For now, sounds fine. Someone else wrote, Chirag Patel's video is on YouTube, I assume. I sent a link that I think is what they were looking for.
Yes, it's a wonderful video. It's 9 minutes long, so I didn't want to show.
Oh, that's not the one I sent. Okay, so how would they find it on YouTube?
Yeah, I can. You know what I can do is I can send it to you, Deborah, and then you can share it. It's definitely excellent. I think he does a really good job with that.
Okay. Someone just adopted 2 dogs 2 days ago, and they had no socialization, although they were in a great foster home, and are acclimating to these people fairly quickly. but they're clearly fearful of all humans. Any tips for desensitizing to friends and other humans until they're able to get more training? And
Right. That's a
mention their dog being, during COVID, not being around people. And now what? It's the same sort of issue.
Right, for sure. Yeah, I mean, I think it's very true. Whether, we don't know that, the dog's acclimating to a new home, or that the person was working at home for the last 2 years, and now, and they're having people come over. It's, summertime. Hopefully COVID is slowly leaving us. And I think, again, we want to make sure that we go very slow. So for the example of the new dogs coming in, we don't want to, of course, have a big party next weekend. And, I know everybody wants to see the new dogs in the house. And if we, slowly acclimate them to the house and to the people living at the house, and they seem pretty comfortable with that, then maybe having 1 or 2 friends come over if the weather's nice, maybe sit in the backyard, let the dogs come out and nobody's reaching for them or trying to pet them, letting the dogs sniff around, and really trying to avoid flooding the dogs with new people, and also, making sure we're very slow and systematic, with our desensitization and counter-conditioning, always having high-value treats, whether the treats come from the new owner or also from the, new person. We do a lot of, I would say, guest protocol, which basically is systematic desensitization for dogs that are unsure or feel fearful of strangers. So we really try to avoid door greetings or trying to enter into the dog space. We try to set it up in a way that the person is already sitting down when the dog is brought out. Now, depending on what the level, right, that the dog is comfortable, usually the dog is on leash and next to the owner, and pairing high value treats to the presence of the new person. So, I think really there's no wrong with going very slow and systematically, and, really being an advocate for your new dog or your dog that doesn't have a lot of exposure to new people during COVID, and, really watching your dog's body language and making sure that your dog is feeling comfortable with the interactions, and also knowing that short sessions and giving the dog a break, letting them go back to a safe place room, or, tossing the ball for them, getting them away from the stranger is also important.
A lot of people are mentioning that they live in apartments and there are dogs everywhere and they don't have the option of distance.
Mm-hmm. Mm-hmm. Right. Yes, I definitely think urban environments can be tricky. And we definitely see this in downtown Indianapolis too. And, whether or not we try to, again, depending on what, the dog is fearful of, if the dog is social, with other people and other dogs, that's great. If the dog's uneasy or uncertain in the apartment hallway, or, taking the elevator up and down, can we try to use the stairs, or can we use a back door, or, again, and making sure, I think a big thing too that we see is that counter conditioning is so valuable. So having those treat pouch or fanny pack with you with high value treats ready to go, and, making sure that you are using counter conditioning if you are very close to the scary stimulus, and if the dog takes, even stops taking treats, right then and there, but then continues after the stimulus leaves, or the trigger leaves, or the person, whatever it is, that to me is a win, you know, if you're in a tight area where you can't increase the distance.
All right, now something needs to be clarified here. Eileen got back to us and she's confused because she thinks that you may be recommending positive punishment.
Oh, no. Definitely not. I recommend positive reinforcement. So I never recommend adding something to decrease the behavior.
So, Eileen, she is not recommending that you use aversives. That was your specific question. So definitely not. Okay. Let me see what else is here. Oh gosh. Okay. Someone else has two large dogs, and when walking, if they see another dog, one of them gets very excited and starts to play fight with her other dog, who acts as if she's being attacked. You can explain that. How can I stop the excitement of my dog who starts this whole situation, she says, because he just wants to play?
So if you, let me just clarify so I make sure I understand. So if you're walking two dogs and then the dog is jumping on the other dog and the other dog is not appreciating the jumping on, or does the first dog see a trigger and then is jumping on the other dog?
Yeah, it's hard to tell. It sounds like displaced aggression but I could be wrong.
Yeah, I wasn't sure either, but let's say that the first dog sees a trigger and then is redirecting on the second dog if the person is walking two dogs. You know, definitely that it's what we call, you know, that they are displaced their aggression, or that they're responding to a trigger that's not involving the second dog, but taking it out, their arousal, frustration, fear level, and so forth. Now, of course, it's very hard if you're walking two dogs and this is happening per se, but you know, that's why if you are having the first dog that's reacting to a trigger, it would be much easier to work with that dog walking and by him or herself, rather than having the second dog there. I mean, definitely dogs too, they can redirect on the leash. They can, you know, redirect on the owner's leg if they see something, and we want to try, at least if they're going up that aggression ladder, how can we ask them for an alternate behavior or use response substitution in that situation to de-escalate them? If we, you know, can try to increase the distance, asking them for alternate behaviors so they're not reaching that level.
Another person wants to know, when a dog sees another dog approaching and lays down but watches the approaching dog intently, are they in relaxed or are they alert still?
Yeah, I think they're alert for sure. I think they're hypervigilant, or, you know, very focused on the other dog, and maybe unsure, right? So their emotions of the other dog approaching, they might be not too certain about the other dog, or they might want to play with the other dog, or they're visually scanning what's going on in terms of that behavior.
This question is how to safely get my dog to visit a home with cats when the dog is extremely aroused by the sight of the cats. And of course, I'm wondering, does the dog have to go? The dog would chase and hurt them.
Yeah, I mean, we definitely, and we get this question, you know, quite a bit if we're trying to introduce a new dog with cats already in the home. And of course, we want to set up very safe scenarios of having, the cat confined in behind a door, baby gates, and also having the dog on leash and making sure that there is a neutral area that, and really starting to work on flow, systematic desensitization counterconditioning for both, the resident cat and also the new dog, let's say, per se. But yeah, visiting is right. I think you always want to err on the safety side in that type of situation.
Heather wants to know which of these methods would be best for decreasing jumping up on people.
Good question. So, I would say for sure that, many different training methods exist, but I assume I would probably remove my attention when a dog is jumping up and then trying to capture or asking the dog for an alternate behavior, and rewarding that behavior like a sit. And then if the dog jumps up, again, removing my behavior. But I'm sure a lot of my trainer colleagues might have other situations. This is again, example of positive punishment. We never want to add something aversive to decrease the behavior, because that can cause frustration, fear, anxiety, and aggression. So I never recommend to knee up on the dog if the dog is jumping on you.
Okay, let's see what else there is. Can a dog bark from excitement and happiness when visitors arrive?
Sure. I think that's a good question, because the motivation of barking can be different in different situations. So if the dog is alert barking, and maybe the dog is happy to see the person, again, barking, what is the dog's body language? We always know that a wagging tail doesn't always mean happy. It just means arousal. So, is the tail wagging? What is the rest of the body? Is the body posture loose? Or is the dog very tense and barking when somebody comes?
All right. Let me see where we are. All right. Our rescue at 6 months is now 2 years old and is fearful of lots of things, has become hypersensitized over time to being in the car. She will still jump in, tolerating, I think, but then pants, shakes, and hides in the footwell area. We are now working on walking her by the car, which she will pretty consistently do, but not take treats. Even going into the garage, if we're not going right outside the side door, can be an issue. Is she over threshold? Should we consider any other starting points? Any other thoughts on sensitization that has become stronger over time?
Yeah, that's a good question for sure. It definitely, I think your plan of desensitization is not bad. I guess we would have to evaluate the whole desensitization and counterconditioning plan in terms of, the dog won't take treats. What is the treat value? Are we moving too quickly? Can we use, I don't know, I'm just throwing this out there, something lickable so it keeps the dog's attention for longer than rather, hard treats? And how do we start the parameters over? Do we need, I don't know, to move the car somewhere else, or is the garage, sometimes we do start in the garage, but it's too constricting for the dog. So yeah, it can definitely be a hard one. And of course, I don't know how many times, like if the dog's has suspended going into the car or doesn't need to go in the car, or the dog is still going in the car and we're working on this, which again can be difficult, but not to say that, I think looking at the overall training plan, if the car ride anxiety is so high, do we need to consult with our primary veterinarian or consult with a veterinary behaviorist to use some anti-anxiety medication to help with this process?
Andy's dog has a different car issue. He will get in and be fine for about 5 to 10 minutes. But after that, he gets sick, often multiple times. They've only been able to take him on trips if they drug him, which they would prefer not to do. Any thoughts on whether this could be physical, like motion sickness, or mental, like anxiety? If it is anxiety, where am I here? Is there a course of action to desensitize him with short trips to start and then longer and longer trips? We got him as a rescue, so we don't know his early background. He's about 4 years old, and we've had him for about 2 years.
Okay. Definitely, I think that brings up a really good point, because I definitely believe that car motion sickness is correlated or can be correlated to car ride anxiety. So if the dog is anticipating that it's going to feel, motion sickness, then that definitely can amp up the anxiety. So I kind of think it's trying to address or treat both using anti-nausea medications. Veterinary prescribed something like Serenia, the motion sickness dose, and then also considering, making sure that is under control before we work on more counter conditioning in terms of the car, in terms of the help with the anxiety.
Can you use Pepsid if it's the right dose?
So Pepsid is more of a stomach neutral, to more for like reflux or acid. So I think, more anti-nausea medications like Dramamine or Serenia, but it's always best to talk to your veterinarian to make sure that you are, even if it's an over-the-counter medication, to make sure that you're giving the right dose.
Okay. My dog has selective leash reactivity. She reacts to usually the ones that are bigger than her. Other times she just wants to play. She also has bad dog-dog resource guarding issues. So introducing a high-value treat to redirect creates a different and more aggressive reaction when a dog is around. Should she work on the resource guarding first?
So I guess it really depends. I think, if you can safely deliver a treat to your dog, whether it's tossing it on the ground in front of the dog and giving the dog space without the dog approaching the dog while it's getting the treat, or, delivering a lick using like a reusable camping pouch filled with lickable treats. I'm not sure, the dog-to-dog resource guarding, I would be more concerned if the dog is crunching big pieces of treat or dribbling and the other dog approaches, or if you give the dog a high-value item and maybe a ball is not a good idea, or a high-value toy while the other dog is near, that probably wouldn't be a good idea.
Okay, if a dog barks and lunges when seeing another dog on leash, but you think that it may be that they're frustrated and want to play, how do you know the difference? And does that affect how you try to handle the situation?
Yeah, it can be difficult sometimes because it can be an emotional, maybe the dog's unsure themselves in terms of what responds, because leash can add a lot of, barrier frustration or leash frustration. So ideally, yes, it is really hard to know, but we know that the dog is feeling some kind of heightened emotions of some sort, even if it is frustration, excitement, fear, so forth. So how can we, help the dog de-escalate in that situation? And really, again, we don't, I wouldn't say just let go of the leash. And that's, of course, that's very dangerous in situations, but kind of knowing what your dog is like off leash versus on leash can be helpful too, with the help of, a qualified trainer and really kind of tailoring the plan that way.
We have a few questions about dogs who aren't treat motivated and how to effectively desensitize a dog when he sees other dogs, other than talking calmly to him, praising him when he doesn't bark, or using watch me.
Mm-hmm. Mm-hmm.
First of all, are there certain treats that I know one dog I heard about who was considered not treat motivated would take, for example, salmon cream cheese, in a squeeze container. Are there dogs who are, one of these dogs won't even take barbecued hamburger. So I don't know, but are there dogs who really are not treat motivated or just not found the right treat?
Yeah, I mean, that's a good question, and we get asked that a lot. I mean, I think dogs have different reinforcers, and their scale of reinforcers can be very different. Dogs definitely have to eat every day, so they ingest calories, and whether or not the dog is not taking treats in certain situations or doesn't like something, sometimes you have to figure out what exactly is going on. But not to say, praise, verbal praise, and petting can be reinforcing to dogs too. So, it really depends on what, even some of my patients, massage or petting is really reinforcing, maybe in certain situations more than a food reinforcer. But always knowing that there has to be something out there that the dog finds reinforcing, maybe even doing a taste test at home, and I'm talking about very tiny sized pieces, less than a pinky nail or less, of treats in a low distraction environment to be able to find something.
Fiorella has a problem that sounds very difficult to me. She has a Westie, and she whines as soon as she's out of the house and will only stop when they arrive at the park. Also, if he sees dogs on balconies, he will freak out and bark nonstop. And next to their house, there are many dogs on balconies, so there's no way to get out of the house with him not freaking out. It bothers her to see him so upset all the time. And she's not sure what to do to make life more bearable for him.
Yeah, I mean, that is, if there are multiple triggers or the level of anxiety is high in certain situations, I think it's best to consider, talking, like having a behavior support team. Thinking about talking to a qualified trainer, also maybe talking to your veterinarian if they're knowledgeable about behavior, or reaching out to a veterinary behaviorist if it seems very overwhelming and you're unclear of what to do in certain situations, if there's multiple triggers going on and, worried about many different things.
Another issue that's come up is squirrels, because she has no control over the distance.
Yeah, squirrels are hard. We can't tell them to go away. That is true. And, that's maybe where we want to do more operant conditioning, or engage, disengage, look at me, pattern games. There's many different besides just desensitization and counter conditioning.
We do have an earlier webinar. We have a few actually that were about pattern games. So you might look at, our YouTube channel, and one of them had to do with attention games. There were pattern games in that. And the last one we had on Control Unleashed talked about pattern games. So those are other approaches that you can look into. Any ideas for a dog that is sensitized or is anxious, even with training activities themselves? This is especially in our house and yard. She seems okay with training on walks, but hard to do car training on walks.
You mean objects, so like cars going past the yard, I assume? That's what they're asking about.
This may refer to an earlier email. I don't know if it's wait a minute. Let me see if it's the person who the dog didn't want to get in the car. I don't know if that's what she's talking about. Well, I'm looking back, but I'm not.
Yeah.
You have to go back
I think the question, could be wrong, is, being able to control the distance of moving cars on walks versus cars passing the yard, maybe, is the question. And, yes, that can be difficult. And it's important to remember that, generalization in dogs is very difficult. So, practicing certain behaviors or working on certain behaviors inside the house, making sure that the behavior is fluent, and then working in, different rooms of the house versus taking it out on walks or taking it, in the backyard, can all be different situations.
Eric just
sure that's
helpful comment, which was that when working on leash reactivity, he also had to work on his own tension. And Gwendolyn helped explain in chat that positive doesn't mean like positive punishment. It's not good or bad. Positive doesn't mean something's good.
Right.
It's
a lot of
think of it as adding something.
Yeah, and maybe I should have explained that further, but I was trying to stay away from operant conditioning too much. But yeah, so adding something is positive. Adding something is to either increase the behavior reinforcement or decrease the behavior punishment.
Yeah, it's complicated, and if you don't need to know it, you don't have to learn it. Just know that we don't want you to use aversives.
Right.
Yeah. Okay.
We never want
go ahead.
Anything that causes pain, discomfort, and causes stress, anxiety over time too.
Okay, and Eileen clarified her earlier question. Her dog almost has what looks like performance anxiety and will shut down quickly with anything that looks like training, she will leave the area or stop taking treats. I wonder what training she's had in the past.
Yeah, I mean, that's a good, I mean, sometimes, yeah, we definitely see dogs like this that present to us a lot. And, you know, whether they find something about the training methods aversive to them, or that they might be have some internal conflict with the behaviors that are the person's asking them for. And, you know, sometimes we don't really know, but we just know that we have to change, you know, how we are working with this particular dog, because, you know, if they're showing signs of stress or conflict with asking them for certain behaviors.
Yeah. I think we have finished the questions. I'm sorry, whoever you are, if I didn't get to yours. I think I got to them all. And I want to thank you for this presentation. It was helpful. Thank you again, Dr. Rigterink, and goodbye, everybody.
You guys do great work. Keep it up. I might have to go to the webinar next week too. You have a wonderful wealth of resources, and you guys are wonderful. So thank you very much.
Thank you. Bye-bye. Thanks.
Thank you.